maybe he thinks he slept wrong or did something wrong, and he woke up with a lot of low back and hip pain. And he's kind of tight and tough to adjust, which we have a lot of patients that are like that, and that's okay. We can do muscle work, and we can use these different tables, this traction table we have in the office. Hey everybody, it's Dr. Randy, Kalkstein Family Chiropractic. I have Bradley here in the office. Bradley's been coming in since June. He came in with a chief complaint of headaches and mid to upper back pain, and also some low back pain. So how you doing with the headaches, Brad?
Good. My headaches have actually calmed down.
And how long were you getting them before?
I had them for a few months, actually.
Okay. So he's in IT, so he's at a computer, he's at a desk a lot, he's seated a lot. So in that profession, you're going to be, or anybody who's working at a desk for a living, which is a lot of people, or traveling for a living for that matter, your shoulders become rounded, your neck goes forward. It puts a lot of stress on your neck and your shoulders. And because your neck's not a weight-bearing part of your body, you may not even realize it's there. You may have a headache or back pain that comes and goes. But until you come in to get checked and we can press on those parts of your spine and feel for where maybe there's been some injury, you may not even know how bad it is. So instead of taking all the medications and doing all the things and trying to self-medicate, I'd highly recommend getting adjusted, especially if you work at a desk for a living and you're getting headaches or upper back pain. So let's demonstrate that. Go face down for me, Brad. You can take that off while you're face down. All right. So he's also been getting some low back pain recently, so we're going to do some drop work on his hips, and I'm going to put him on the traction table here and demonstrate some decompression. So his right hip's out a little bit. So we'll do a nice little drop work here. And we're going to do some trigger point work in his upper shoulders. Alright, so he's doing much better now, but he's getting a lot of tightness in his traps on both sides, left and right, and his rhomboids down through here. These are the muscles that attach to your shoulder blade, which sits here, and they run up into your neck, or they run over to your thoracic spine. So the adjustment in combination with this soft tissue work really helps to not just loosen this up, but get to the root cause of your problem, which is this segmental joint dysfunction and adhesions that build up in your muscle. And like I was saying before, a lot of patients, when they come in, they don't realize how bad this is until someone presses on it. And I'm not using a crazy hard pressure, but just a nice firm pressure just to break up some of the knots and adhesions that build up in his shoulders. Go on your back for me, Bradley. Go back on my hand. Good. One more. Set. Good. Just relax your shoulders. I got you. Good. And one more, nice and easy this way. Good. There's his mid-back, his neck adjustment. Just going to hold a little more soft tissue pressure in his suboccipital muscles. Again, when your head's forward and down, these muscles right below your occiput get stretched, and kind of, so we'd like to work on those and maybe even do a little bit of traction here. Pick your head up for me. Relax it. Good, nice and easy. You okay there? Mm-hmm. One more, Bradley. Decompression there. And hang on just where your arms are right there. Okay. Nice and light. Just relax your hip, but hang on. Don't let me pull you. Good. And this one too. Relax your leg. Perfect. Okay, so now we're going to throw them on decompression. Let me do your shoulders too, actually. Come on up. Swing your feet over. We're kind of getting the full spine works here. Good. And this one. Tighten them in. All right. Okay, hey everybody. Back with Brad here. We've done a couple with the decompression table. I wanted to shoot it again. So again, he originally came in with neck pain, headaches, upper back pain. We were basically to the end of that treatment. You obviously just saw the adjustment. So we're about to release him from that sort of care. Now we'll still do some maintenance work with him on that, but then maybe he thinks he slept wrong or did something wrong, and he woke up with a lot of low back and hip pain. And he's kind of tight and tough to adjust, which we have a lot of patients that are like that, and that's okay. We can do muscle work, and we can use these different tables, this traction table we have in the office. This is called lumbar decompression or lumbar traction. And you can see here, we have him set up here. This strap here holds him, is attached to the table and kind of holds his upper body in place. And then the lower part pulls from his waist down, so it gives a nice decompression effect. All right, so we'll just let him go on this for like 10 minutes. And again, it's a nice tool, nice treatment for low back, hip, sciatic pain, people with disc pain. A lot of people with disc pain, maybe you're worried about getting adjusted because they don't want to make the disc, which is already hot and very painful, worse. And that's not the case. You absolutely can get adjusted. You definitely can be on decompression. A lot of physical therapy offices use this table. And we have some other therapy traction tables we use for low back stuff, but this one seems to work really well on patients like it. It worked for Brad after one visit. So just wanted to give you a shot of him on this. And how are you feeling on that?
Good.
Feel a good pull from here?
Yeah.
And this kind of grabs his waist, and so we set it for 10 minutes, and then and that'll be it. So thanks for watching. If you're having low back pain, obviously the neck pain, the headaches, we've done that plenty of times. We'd love to see you in the office. Thanks.